So whether you are starting a brand new medical practice or you're relocating down the street, in this video, I'm gonna share with you 10 tips that you must keep in mind before you sign that new office lease. Tip number 1, understanding your space needs. You're gonna need about 200 to 250 square feet per exam room, and you should be allocating extra space for things such as your reception room, waiting areas, break rooms, administrative offices, and even specialized equipment. And if you plan to grow down the line, like adding partners, hiring staff, or expanding your services, you wanna negotiate the first right of refusal on those adjacent spaces. Poor planning can lead to costly moves or suboptimal layouts. Tip number 2, zoning and use restrictions. Not all office spaces are zoned for medical. Make sure the building is approved for your specific type of practice. Even within medical use, some leases prohibit high traffic clinics, surgical centers, or even radiology labs due to liability or noise concerns. Always verify with the city and the landlord in writing. Tip number 3, tenant improvement and build-out negotiations. Medical offices almost always require build-outs. They're very expensive. Think of plumbing in multiple rooms, X-ray shielding, and even special ventilations. These get very expensive. Landlords almost always will offer a tenant improvement allowance somewhere between $30 to $60 per square foot, and the longer you sign that lease, the more that the landlord will give you. Get quotes before you sign, and even negotiate free rent during construction so that you can offset the downtime where you're not bringing in revenue. Number 4, lease term and exit clauses. A typical medical lease will range from 3 to 10 years, but make sure that you negotiate early termination rights, especially if you're growing or plan on relocating in the future. Look for assignment or sublease clauses in case you sell your practice. Exit flexibility is crucial, especially in group practices or even startups. Tip number 5, rent structure and hidden costs. Know what you are paying. There's really 3 types of leases, and understanding which type of lease that you're getting into will help you understand and budget properly. The first type of lease is called a gross lease. This is an all-in-one price, very easy to understand. All of the expenses are just included at a fixed cost. The second type of lease is what's called triple net lease. It includes the base rent and other pass-through expenses on top, such as taxes, insurance, and common area fees. The third type of lease is what's called a modified gross lease, and that is in the middle between a gross lease and a triple net lease. Typically, when it comes to medical office space, it will be what's called net or plus electric, meaning that everything's included in the base rent. You just have to pay for the electric that you are using. Rent may seem low, but these escalation clauses that happen annually that bump the rent from 3 to 4 to maybe even 5% on an annual basis, plus the pass-through expenses on a triple net, can add up very quickly. You want to review the operating expense history so that you don't have surprises. Number 6, exclusivity clauses and competition protection. Without having an exclusivity clause, a competing practice can lease space in that building. Always negotiate exclusivity for your specialty. This protects your referral network and your patient volume. Number 7, compliance and infrastructure needs. Medical spaces must meet ADA, HIPAA, and OSHA requirements. You may need lead lining walls for radiology, additional power for surgical suites, separate sinks in all the exam rooms, private staff bathrooms that are not shared with the patients, and even proper ventilations for certain procedures. Don't assume a space is move-in ready. You always want to make sure you have a medical contractor to evaluate it. Tip number 8, parking, access, and visibility. Patients care about easy access and convenient parking. Look for at least 6 spaces per 1,000 square feet that you occupy, and clarify if the parking is shared or it's reserved. If you're on an upper floor, ensure elevator access and signage are visible from the street. These impact patient retention and practice perception. Tip number 9, negotiating with leverage. You want to start the process 12 months before your lease ends. This gives you leverage to compare multiple spaces, get landlord concessions, and avoid a rushed decision. Even if you want to stay, having another option allows you to negotiate better terms with your current landlord. Tip number 10, buy versus lease. When does it make sense to own? If you're in a stable long-term location, buying can build equity and reduce long-term costs. You can also lease extra spaces to other doctors. Financing is often easier than you think, especially with an SBA 504 loan that offers low down payments as low as 10%. Ownership turns your rent expense into an investment. Now I'm going to share with you 3 bonus tips that weren't in the initial 10. Tip number 1, don't trust the landlord's broker to protect your interests. They work for the landlord, not you. Bonus tip number 2, lease renewals are negotiable too. Don't just accept the new rate. Get fresh concessions for your new lease. And bonus tip number 3, last but not least, hire a tenant rep broker who specializes in medical leases, and it usually will cost you nothing. So hopefully this video provided you value, and make sure to keep these 10 tips or 13 tips in mind before you sign your next office space.